What is biceps jerk or a biceps reflex? If we tap on the tendon of biceps in front of the elbow with the help of a knee hammer, gentle flexion of the elbow will be there, followed by relaxation or extension of the elbow. So biceps muscle contracts followed by relaxation. Why? Because of the stretching of the tendon by the knee hammer, we stretch the tendon, that is stretch reflex or the biceps reflex. It's also called as biceps jerk because there is a jerking movement of the elbow. Immediate flexion followed by extension. So this contraction and relaxation of the biceps brachii muscle is due to the reflex movement, its connection with the spinal cord. So C5-C6 root of the spinal cord forms the upper trunk of brachial plexus, which divides into ventral and dorsal division. The ventral division of the upper trunk and the middle trunk of brachial plexus joins together to form the lateral cord, from where the branch comes, that is called musculocutaneous nerve, whose root value is C5 and C6. That comes and supplies the biceps brachii muscle. This muscle has got two heads, therefore called biceps brachii muscle. The long head arises from the supraglenoid tubercle of scapula, encircles the head and comes forward in front of humerus, whereas the short head arises from the tip of the coracoid process. Therefore, it is called the short head. Both the head joins to form a common belly, that is a biceps belly in the middle of the arm. Then it runs forwards to form a tendon in front of the elbow joint in cubital fossa. There is biceps tendon. This tendon is inserted onto the posterior rough aspect of the radial tuberosity. So upon striking the biceps tendon, there will be stretch reflex. Because of the stretching, the afferent goes via C5-C6 and immediately the efferent comes via the musculocutaneous nerve, resulting in sliding of actin and myosin within the biceps brachii muscle, causing contraction of the muscle. This is immediately followed by relaxation. So this is the normal jerk. So indirectly, by doing biceps jerk or biceps reflex, we are testing the functionality of the spinal cord at the level of C5 and C6. Imagine if there is a lesion, upper motor neuron lesion in cerebral cortex or above the level of C5 and C6 in the level of spinal cord. The upper motor neuron normally is inhibitory towards the lower motor neuron of the spinal cord. So if the inhibition is taken over, then lower motor neuron will overact. So that time there will be exaggerated reflex, like this brisk reflex will be there. Whereas any damage to the spinal cord at C5, C6 or the upper trunk of brachial plexus or the lateral cord or the musculocutaneous nerve results in paralysis of the muscle. So thereby absent reflex or minimal reflex. The minimal reflex will be there or absent. That is a function.